Okay, we're going to call this Finance Committee meeting to order. Present are council members Marmee, Cost, Bub, Floyd, Roletta. First item on the agenda is a request for legislation authorizing and directing the mayor of the city of Newark to prepare and submit applications to the Department of Homeland Security for fiscal year 2014 and 2015 Fire Act grant programs in support of training programs, equipment purchases, funding for personnel, fire prevention, and fire safety programs throughout the city.
That's correct. This is our annual application that covers 3 different programs. The upcoming grant that FEMA will be reviewing is the SAFER grant. That is commonly known as the hiring grant for fire personnel. The grant is a 2-year grant. There is no local match.
Okay.
Motion.
Second.
Motion by Bob, second by Floyd.
Mr. Chairman, can I ask a question?
Certainly.
It's my understanding we're going to try to get enough to hire 2 firefighters if we can. Is that correct?
That's a number I've heard.
Okay. Could we ask for more?
You can ask for as many as you want.
I mean, I know the concern is that if you get it, then when the money runs out,
Well, you can ask for, let's say you ask for 4 firefighters.
Okay.
Then when the award is announced, let's say you're looking at your budget and say, well, we can't afford 4, we can do 2. You can go back to them and say, this is what we can do.
Okay.
Once you enter into the agreement, you have to agree to the terms of the grant for 2 years. So, for example, if you had 72 firefighters when you applied for the grant, and you were awarded, let's say, 2 more firefighters, okay, that's 74. During that 2-year period, you need to make sure you retain 74 firefighters for the 2-year period.
Now, can these grants sometimes be renewed?
You can apply every year. They do not renew the same application. Okay. Some grants do that. You have to reapply and make your pitch another year.
Okay.
Each year.
Okay. Thank you.
Sure.
Yes.
So if you would try to renew, I'm assuming it would be, again, based on how many firefighters we're projecting that we would like to have or need. But would there also be a situation where we've had them for 2 years? Can it be renewed based, if we weren't able to, say, if we don't do this, we're not going to be able to keep them? I mean, could it have a financial consideration as well as a need for the personnel itself?
You would have there is a waiver if a city gets in a bind, and the waiver is not just for the fire. It's for overall safety in the city. We've never been in that situation, but they do have an out if a city encounters a financial situation where they can't fulfill what they thought they could under the terms of the grant. Now, as far as in 2 years, there'll be a new application period. You have to make your pitch for why you need additional firefighters.
So we're not matching this. I'm sorry. We're not matching this in any sense then.
No, there is no local match. When we got the SAFER grant several years ago and we hired 3 new firefighters, there was a local match and there was a retention period that covered the end of the grant. That's not the case with this application. It's a 2-year grant cycle where all the salary and benefits, and that includes, the Medicare, the pension, workers' comp, and insurance. That's covered for 2 full years. And then after that, the obligation goes away. So in 2 years, if, for example, we ran into a different situation. I'd have to look at the terms of the grant as far as what kind of pitch that we would be making. If it was a retention issue and we were allowed to do that, we could apply, but I can't project what it'll be the next time we apply if we're awarded. Now, most of the fire grants, they don't make a single announcement and everybody knows. They go through these different rounds, and right now they're projecting that the safer announcements will be around the end of September. But that's the first announcement. They could go over maybe a whole year making announcements. So it's very possible that if we're awarded, it may not even impact this 2016 budget. It may be 2017. It all depends on if we're fortunate to be awarded a grant. We get word, and then we go through the civil service process.
I've got one more question if I'm allowed. Is three's the limit? If we would get to the end and attrition would have, we'd have had a couple guys retire, then does that bottom line number, would that be a factor also in the grant, or how many we would be able to ask for as well?
Well, you can decide, any community can decide on how many firefighters they want to fund, but of course you have to have the budget. You want to look down the road to see if you're going to be able to fund them beyond that period. You won't be penalized. If you have a lot of retirements, let's say 2 years down the road, you can come back and, if the program's still around, and ask for, 5 firefighters because we had this many leave due to retirements or went elsewhere.
I see.
So.
Thank you.
Yes, Mr. Mayor.
Yeah, just additional information. If that happens during the 2 years, you have to replace it.
Yes. Oh, certainly.
No.
I was just wondering.
And it's all personnel costs. If there's training costs, equipment costs, uniforms, whatever involved, those are not covered. So, and then I'm not making a big deal, but I'm just saying at the end of the day, understand there still are costs associated. While they're not required to matching, it is 5-1 or personnel count dollars they're paid, which is good. So.
Mr. Chairman.
Yes, Mr. Rowland.
First of all, I'd just like to thank Mrs. Gilks and the administration for their work in putting this together. I think it's a very good thing. I think we need to take advantage of these opportunities while we have them, or we're going to miss out. Just one question. Maybe this would be best for the safety director or the mayor. I'm not sure. What reasoning, if the number's 2, what reasoning went into the number that you all would like to apply for? I was just curious.
I could address that, Mr. Chair. Very, very good question, Alex. What we've done is Chief Connor and I, as well as our mayor, have tried to forecast what we can afford long term. What I don't want to do is say, hey, give us 4, and then a year from now or 2 years from now, gee, we don't have the bucks to keep them around. We don't think that's fair. A young person that gets a good job, they get married, they buy a house, and all of a sudden they're in a lurch. So I'm comfortable with the number 2, but as of today, we're kicking around, do we go for 3? We're going to have some more dialogue with Barbara, but I'm uncomfortable any more than that. I just don't think we can sustain them long term.
Okay, so there's no hard guarantee on the number right now. You're still debating that.
I'd like to discuss 3. I'm a people guy. I'd love to grab 8 or 9 if we could, but that just wouldn't be fair to some young person to hire them, knowing 2.5 years we can't sustain that. So, as I'm before you today, I'm very comfortable with 2. But again, the mayor and I and the chief met this afternoon. Could we work 3? And quite frankly, I can't tell you that with certainty. Who knows what tomorrow's going to bring? But we can reasonably forecast. So 2 is my number now, but I might get talked into 3 as we progress near the deadline.
Thank you.
Any other questions, comments? Seeing none, all those in favor signify by saying aye. Aye. Those opposed, the motion passes 5-0. Next item on the agenda is a request for legislation authorizing and directing the mayor of the city of Newark to apply for funding for the United States Department of Justice, Bureau of Justice Assistance under the Bulletproof Vest Partnership Grant Program. Excuse me.
Can I ask one question?
Sure.
On the fire grant? We need to waive the second reading.
Expedite it? Okay.
Okay, this is our annual Bulletproof Vest Grant application. The feds will pick up 50% of the cost. of a vest for the police department, and then it also, our probation officers and arson investigators qualify under the program. Since we've been applying, the city's been awarded over $78,732 for vests. So.
Motion.
Second.
Motion by Floyd, second by Bub. Questions or discussion? Yes, Mr. Scott.
Yeah, Mr. Chairman, Barbara, when the probation department gets vests through this program, does that come out of court funds or does it come out of city funds as far as whether if there were a match or not?
Well, the probation would have to front the total cost, and then they would give me all the information, and I'd ask for 50% back. Now, I don't know what constitutes their budget, if it's all general fund or if there's court costs and general fund in their budget, but they would have to front those costs.
Thank you.
And the courts fall under the general fund anyway. So
Okay.
it's all general fund.
Okay.
So, any further questions or discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Those opposed? That motion passes 5-0. Thank you. Next item on the agenda is a request for appropriation in the amount of $450.
Good evening, Mr. Chair. The piece before you is for what was previously Assistant Chief Pat Connor, who is now doing an excellent job as our fire chief. Supervisory staff, as you know, are not entitled to any compensatory time, so we'd like to clear this balance and make him whole. And I would ask as a courtesy, we expedite, please.
Motion. Motion by Bob, second by Cost. Questions or discussion? Seeing none, all those in favor signify by saying aye. Aye. Those opposed? Motion passes 5-0.
Thank you.
Next item on the agenda is a request for appropriation for David Rhodes' own personal fund of $1 million.
That would be a conflict of interest, wouldn't it? And the paper would be here to write about it. I can see it now. We're just moving some money out of the 334 construction fund into the professional services account so we can pay some bills, anticipated bills that we're going to be having on the new fire station.
Motion.
Second.
Motion by Cost, second by Bub. Further questions or discussion? Yes, Mr. Guthrie.
Thank you, Mr. Chairman. Dave, that $1 million, I mean, what vendors are in line, for instance, for their share of that? I mean, is it the general?
It's a general contractor, which would be Robertson Construction, also the architect, which would be Wapto Macnow.
Okay, thank you.
Further questions? Seeing none, all those in favor signify by saying aye. Aye. Those opposed?
Aye.
That motion passes 4-1. And with that, this meeting stands adjourned.
Thank you, Mr. Chair.
Thank you.
We'll call the Capital Improvement Committee to order. Present is Mr. Rath, Mr. Roletta.
Yeah, I'm doing service here, okay.
Mr. Cost, myself, and standing in for Curtis Johnson is Mr. Marney. We have one item, consider resolution number 1518, appropriating monies for the current expenses of the municipal corporation. Section 1. There's hereby an appropriation of the unappropriated balance of the 335 Capital Improvement Fund in the amount of $69,307. Mr. Rose?
Thank you, Madam Chair. There's two items, both of them for the street department. The first item for $45,331. It's a one-ton dump truck that we'll be purchasing for the street and traffic department for various uses. And it will be bought locally here, and it is a needed item, hauling gravel, hauling sand, doing ditch work, doing everything. That's the first item. The second item has to do with the street department. We have an item called a patch box machine. It holds the hot mix and the cold mix when we fill potholes. We've burnt the bottom out of that machine 3 times, and it's time for a new machine. We do have two machines that run. One of the 2 will be retired, making up my total request.
Are there any questions?
Motion.
Second.
All those in favor say aye.
Aye.
All those against, the same sign.
Aye.
Be 4 to 1. Thank you.
Thank you, Madam Chair.
Thank you. This committee is adjourned. Next is service.
We're going to open this Service Committee meeting. If we could, as the phrase says, at the discretion of the chair, Steve Lehman would like to give a brief presentation on a rezoning issue. If Mr. Evil will be so kind to allow that, appreciate it. Thank you. Mr. Lehman, you're at the mercy of...
I am. Thank you, Joe. There is next council meeting either hearing or a vote on a zoning on Cherry Valley Road. There's 10 acres that we have requested to be zoned MFR instead of MFC. Neither my partner nor I can be here next week, so I thought it might be prudent just to come and see if there are any questions or if you want an explanation of what we're doing, because neither one of us can be here next week.
Are there questions on the indulgence with an explanation? Let's start there.
The property was zoned for condominiums. If you remember when we redid the zoning ordinance, it was based on intensity of use as much as anything. Condominiums allow for 6 units to an acre. When we met with Planning Commission, we agreed that if it was zoned for multifamily residential, that we would agree to the density of 6 units to an acre. If you know that property, it sits on the hillside there at the bend of Cherry Valley. The old Vaughn house sits up on the hill. The density on that piece of ground will not be more than 6 units to an acre because of topography, if nothing else. The reason for the request is we had a prospect that got to letter of intent stage that wanted to build expensive apartments, and their density was 6 units to an acre. They could condominiumize it, but that wasn't their intent. They were intending to build apartments. To us, it just seems like it's a difference of how the property is titled more than anything else. The development would be the same. Just seemed to be easier on everybody if it was zoned MFR. Whoever wrote that ordinance didn't give the flexibility in the MFC district to allow apartments. You have to build condos in the MFC district, and that wasn't what they wanted to build. So, be the same product. That wouldn't change. The density wouldn't change. It's just the title, the name of, or how the property would be owned or titled. That's all. It's pretty simple, really.
Will that house remain?
No, the house will come down. Yeah, it's right in the middle.
Did I continue on? Sure. Okay. Is that property go all the way to West Main Street?
No, the 10 acres is surrounded. The 10 acres is surrounded by land owned by partners in that land. Englefield and Kennedy own 20 acres that separate it from West Main and from Cherry Valley. Jim Havens and I own 13 acres that separate it from the condos that front on Reddington. And Englefield and Kennedy and Dave Anderson and I own 9.5 acres that separate it from Thornwood. So it's just an island in the middle there.
I don't know how any other way to ask this. Are you Are you encountering anyone who is resisting this in any sense of the word? As far as, I mean, obviously your one neighbor, you probably sort of...
All the neighbors seem to be okay with it. It's just, it takes councilmatic action, and since we couldn't be here for the council meeting, thought I'd come and ask if you had any questions or concerns, so I could try and explain what we're doing, that's all. The way that land lays in there, it's all ridges and hillside, and I think it's going to be a beautiful development eventually, but I don't think the density will ever be more than 6 units to an acre.
So how many total units are you? 40?
Well, we had 25 acres totally that were involved in this thing, and it would have been probably 120 units all total, which I think is less than 5 units to an acre. But I mean, Newark will only support so much. Yeah.
Entrance access is going to be off of Cherry Valley?
Entrance access would be from Cherry Valley.
My biggest concern is going to be the cedar-sided house on Cherry Valley adjoining that property and drainage and issues. That seems to be a low-lying.
Well, actually, Englefield and Kennedy built a drainage pond in there a while ago at the request of the city. I'm going to say 10, 15 years ago. My guess is that the best thing that can happen for that neighborhood for drainage would be for development to occur. Simply because, as part of the development process, you've got to build storm drainage systems, which would get the water out of there and take it to the river rather than let it just. Right now, it's just coming down the hill and goes where it goes. Upon development, that water will be captured and redirected towards the river. So my guess is it actually would help the neighborhood to have that land developed. Drainage system gets formalized that way.
Any questions on that, Mr. Guthrie?
Thanks, Mr. Chairman. Steve, if I understand you correctly, if you're going to take the water away to the river, so there should be no impact on the Simross property?
No, we're not. They're on the other side of the hill.
Right.
So Simross will be fine. They may get impacted when the land on West Main gets developed, but that's a different issue, and that's a different piece of property. I mean, common owners, but that's not. Everything, what we're talking about, Mark, is on the north side of the hill. Simross is on the south side, and that hill's, the elevation differences are huge there. No water from what we're doing will ever get anywhere near Simross. The house you're talking about fronts on Cherry Valley to the south of this. It's the next property south, right?
Yes.
Okay.
I had to think about that.
And there has been drainage problems there. There's no question about that. And like I say, Englefield and Kennedy did build a basin at the city's request. That basin may go away, but a different structure, a better structure would be built to solve that problem. So I mean, hopefully the land gets developed. We're just asking for it to be titled, be able not to have to be a condominium. It won't change the density. And we've agreed to 6 units to an acre on that 10-acre piece.
Is there any other information you want to provide for us before next Monday? Is there anything?
I don't really have anything else other than that's the rationale. It does, we have the right to put 6 units to an acre there now. We're not asking for anything greater than that. We're just asking that it be able to be titled to one entity as opposed to condominiums where it's individually titled. That's all.
I do have another issue to ask you about that property now that I know that you own it, but not here.
Okay.
Any other questions out of the audience?
Thank you. Sorry I can't be here next week. Be gentle. Thanks. Thank you, Jack.
Thank you. Thank you to the committee. I was just made aware of that. Thank you. Mr. Eagle? Give a presentation.
Your discretion.
Same thing, I have mine.
You're the chair. By second.
Thank you.
Thank you, Joe.
But we're also noting that Mrs. Floyd is filling in for Mr. Wade on this committee. Thank you. Joe, thank you.
All right, well, this is our kind of annual report, wrap-up of 2014, to kind of give you an idea of what we did last year and what we're looking at for next year. So you have the annual report. That went out in the mail a week or so ago, and so it went out, we mailed out to about 300 people in the community, mostly elected officials. And then it goes out through our email list, which is about 1,300 other people, and then through Facebook, which is like 2,600 people, and Twitter. So we try to get all that information out there. This year we condensed it a little bit just because we really figured most people don't sit down and read, a 16-page annual report. So we try to keep what we thought was relevant in there without getting way too much information. Last year we had a couple of unique things that came up. Measles and mumps were reintroduced back into Ohio. We had the measles outbreak, which kind of originated at OSU on campus, and we did have some cases that were related to that came over and crossed the border. And then we had the measles outbreak, which was really from the Amish community that they did a mission trip, or they went over to help in the Philippines, got infected, brought it back, started spreading it among the other unvaccinated population in the Amish communities. And that, fortunately, we didn't get any diagnosed cases here, but we spent a lot of time working with Knox County to our north, where they did, because our epidemiologist also covers their area. So that was an interesting challenge, but in reality, we've heard an awful lot about the cases coming out of California and Disneyland, and Ohio had more cases than all of those put together last year. But because it was mostly restricted to the Amish community, we didn't really get the national attention that one did. And then as far as diseases, we finished up the year with Ebola. So that one there, one difference is there's no vaccine against that one, so we can't really prevent it so much as it is monitoring. So we did a lot of exercises, worked with our firefighters and EMS, our police, the hospital, EMA. Did some drills to make sure that everything was done properly, worked with the hospital while they were doing their drills. As it turned out, we had one case that supposedly the person had claimed that they were infected, and we responded with the fire and police in Newark and found that in fact he was not infected, but we still had to go through the same protocols, because until you can establish that, you don't want to take any chances. And we had one international traveler that was coming into the county that had gone to Africa, but by the time we followed up, they turned out they were visiting someplace on the East Coast before they came back, and weren't going to be back in Ohio until after their kind of monitoring period had expired. So a lot of work, a lot of planning and exercising. Unfortunately, Ohio then, we did not have any cases, so that was good. But there were an awful lot of health department hours spent, monitoring, checking up with those people that might have been in contact, making sure they didn't develop a fever, those kinds of things. And I'm sure we're going to, be required to do some more planning on that as we go through 2015. The good thing with all of those are, you get to go through all the exercises and really kind of, flex your muscles and build your capacity. And then when you don't actually have people getting sick and die, that's the best case scenario. So you're able to kind of do what would have been a planned exercise or a tabletop or something on a small scale. You're able to really do in kind of real time, real world scenarios, and we make sure whenever we do those, we do after action reports and look at what we did right, what we could do better, and work with our partners. So it seems like there's enough things like that happen. We don't have to do a whole lot of sit around a table kind of drills, because we're always kind of working on those real life scenarios that come up, and keep that contact with all those partners, so when you do show up, the police and fire know who you are, and they know that they can work with you and know how things are supposed to go. Last year, we did continue our quality assurance and our quality improvement. In 2013, we became nationally accredited, and now after 1 year, we had to submit a kind of follow-up report of what we're doing to work on the things where we didn't score the highest possible score last time. So we're continuing to work on that. Just because we were accredited is not a one-time thing. They expect that you have to be formally reaccredited every 5 years, but basically every year you have to show them that you're continually working on improving. Our Medical Reserve Corps, our volunteers that we have, that picked up. We hired a new public information officer last year, and she's taken command of that volunteer group, and they've been more active in the end of 2014 than they've ever been, and we've had that group for a long time. So I look forward to continuing to have those, not just so that we can kind of activate them when there's a real emergency, but also keep them active. If we've had them do STD clinics with us, work at races and events and do different things, so you're able to kind of keep them engaged and not just kind of waiting until there really something serious comes up. For environmental health, the one thing that really stood out was our food program. The number of inspections jumped up considerably, and I think most of that was due to our enhanced enforcement program we put in place. The state requires us to inspect each restaurant, each grocery store twice a year. But unfortunately, what you find sometimes is you go out and, there's broken floor tile, the ceiling's, got leaks, there's lots of problems, nothing bad enough to shut them down, and you tell them to fix it. You come back 6 months later, it's the same floor tile, it's the same, and time after time. What we decided to do was to take those and say, we've cited you, you still haven't fixed it, and maybe you have a lot of things, none of which by themselves are a critical violation that are going to immediately make someone sick, but you're not living up to your obligations to properly maintain your facility. So we put them into increased inspection frequencies and made them, really hold them accountable for making sure that they take care of those things. I've had a couple of facilities come in for hearings with myself, and I've gone out and done inspections to see what the site looks like. We've had a couple of them taken before the Board of Health to kind of basically threaten that we will take the license if you don't kind of pick up and really deal with some of these issues. Sometimes they are temperature violations, things like that, where we have those kinds of problems, and those are obviously the most critical, but there's other ones where it's just been, deferred maintenance for many, many, many years, and we finally, kind of finally putting the pressure on, saying, it's past time to take care of these problems. The grants, we hired a new grant writer to replace one that left, so we had a little bit of a lag there and kind of applying for new grants, but that person's stepping up. We have a couple new applications that we're working on now, working on local government efficiency. I just went through last month the Lean Ohio, Lean Six Sigma kind of training that Ohio sponsors, and that kind of took us one step above the quality improvement tools that we already have, and we're working on a couple of other grants to kind of bring that into the agency and work on process improvement, being more efficient, reducing the amount of time that it takes us to do things and the costs, so that we make sure we're really focusing on getting the important things taken care of and reducing redundancies and waste. So looking forward to working on that a lot here in the next year. Other than that, taking questions on anything you guys saw or any questions you have about what's going on.
I know smoking is a major issue in Lincoln County. What kinds of things are you doing to try to get people to quit?
Well, it is a major problem, and it was about a year ago that we kind of created this big goal of reducing the smoking rate by 50% over the next 10 years. And we're doing a community health assessment this year where we're having Wright State University calling 500 households and asking a bunch of health questions, and smoking is one of those, so we'll be able to see where we really are. The last time we did the survey we were about 26%. Last national number I heard was below 18% is the national average. So it's Ohio in general is bad, and we're worse than the average there. So we've done a lot of things for years that we thought really haven't worked, apparently. So this year, fortunately, we have a grant through the Ohio Department of Health for tobacco prevention. One of the things that's interesting this year is we're creating it's called STAND, but it's a youth-led prevention program. So we have a team that is out of the Licking Valley area, out by Marne. We have one that's more in the Pataskala, I think it's Licking Heights, down in that part of the county. We're also working with the Youth Leadership Council, that group, and they've developed their own advertising campaigns for prevention. So that'll be coming out in March. There'll be billboards, it'll be on TV they wrote the scripts, they act them out, they put all of it together. So we're trying to get, instead of adults telling the kids that they shouldn't smoke, trying to get the other kids telling the kids they shouldn't smoke. So we're excited to see how that works out. They're also pushing for smoke-free multi-unit housing, so like apartment buildings, trying to get those kind of places to go smoke-free. Some of them have shared hallways, but even if you don't, if you've ever been in a condo or something, if you have a patio and you have your door open and there's a unit below you and they're smoking, doesn't matter. It seems like, there's somebody next to you and it'll get sucked right into your house. So I did hear we had a couple of facilities that were very interested in doing that just last week, so we're hoping to build on that as well.
Thank you.
So are you saying that the program that you're going out, Licking Valley area, is that going to be taken and presented to the other schools in the county, or how do you see that?
Yeah, it's not really school specific. They can, we've been working with the Yes Club kids as well. Mm-hmm. So it's, we'd like to have multiple groups, and it's just kind of where they've kind of taken the initiative and said that, that they're interested in doing it. So somebody, from Newark could go to the meetings in Marne, or we could work with them if there was a big enough group just in Newark that wanted to do it. They certainly could start up their own little group. So they're kind of one unit, but there's it's almost like Cub Scout. There's different packs, so you don't have to. Everybody doesn't have to travel a long way.
Any other questions?
Thanks, Mr. Chairman. Joe, glad to hear you're collaborating with Wright State. I've got a lot of good programs there. But tell me, of the 500 calls that are being made, number one, will we get some kind of report of how that survey went? And secondly, do you have any idea what percent of those calls are being made in the city of Newark?
Well, let's see. The first one is the report. This survey is part of our community health assessment, and normally about every 3 years we come out with a new, a completely updated report. And this is one of those cycles where when we get all of these done, and they do them over the course of 12 months so that you don't ask people about physical activity in January when they're all shut in the house because it's zero out. So they kind of spread those out. So at the end of 15, they'll wrap that up. We'll get the report from Wright State in 16, and then we'll put that into a report to release to the public during 16. And then we'll also include in that our local public health system assessment, where we look at all the health services, not just for the health department, but community-wide. A community themes and strengths assessment that we do, and a forces of change, looking at things that may be coming, that are going to affect our community, and that all goes into one report that'll come out in 16. And then the current report we have that we did in 13 or 12, I think, we kind of update it as new data becomes available rather than instead of publishing a whole new one. But that'll all come out. And as far as the survey methodology, they make sure that, like in Licking County, say if 20% of the people are aged 60 to 80, that you don't have 50% of the answers coming from 60 to 80-year-olds. So they make sure that if they need more households in a certain zip code or a certain area, they make sure that we're not oversampling one area and undersampling another, because the CDC sets up those criteria on making sure it's really representative.
Thank you.
Any other questions from the committee or audience?
Thanks for coming in, Jay.
Thank you.
I will mention, Chad asked me to mention that these blue stickers will start showing up in restaurants. It's not like a grade system like in Columbus, but it'll have the date that it was last inspected and who the inspector is on the bottom, and those are going in the door, so when you go in, you can see when it was last checked. And then also, it makes it a little bit easier if somebody has a complaint, they know who to contact. So far, the places seem to be pretty excited about.
Well, the temperature is above -10, it'll stick to the...
Yeah.
That's a great idea.
Yeah, the static cling doesn't work well when it's
doing any of those this month.
Yeah.
Thank you. And this meeting is adjourned. Thank you for the college.